we were we were probably the first real customer, I think, with any volume or any magnitude, but it's very relevant on how we apply the mobile pay stuff too. So we're an orthopedic, we call it musculoskeletal rev cycle firm, really focused on ortho, pain, spine, ASCs and imaging. Yeah. And then the other, other ancillaries, I would say DME, physical therapy, occupational therapy. So really everything that comes around that, the orthopedic spine pain practices. And, so the company's been around for 40 years. We've really focused in that market. I think one of the big things we bring is also the rev cycle, but strategic advisory, help our practices grow, help them. We always use this term, total financial health. I think the other key thing for us is we're system agnostic, which plays into why we leverage this mobile pay solution. Is we do a lot of work on most of the big systems, the Athenas, the Epics, the Next Gens, the Allscripts, all the systems that we, eClinical and so on, ModMed that we integrate with. So we have to be flexible and nimble when we bring a technology solution that we can get it to work with other systems. We understood that statements, the old antiquated patient statement process was not efficient, not effective, costly. We were looking for solutions that would allow us to really, one, use it across all of our clients. So that's, a challenge in itself with you dealing with multiple systems, and two, something that was simple to integrate and it really allow us to increase the velocity of payment. And we knew we had to do something. We looked at a lot of systems. We looked around and we knew that we couldn't sustain increased patient balances, increased patient AR. All the sites that we were bringing on as new clients, we're seeing, we're inheriting these piles of the patient AR that they hadn't done anything with. They were just doing the normal statement cycle, right? Initial 30-day, 60-day, 90-day, maybe turn them over to collection, they weren't overly proactive there. So we were seeing this opportunity that we can collect that money at a relatively low cost, going to drive up our margins, help our business, and in turn, and help our clients, obviously. So
so it sounds like inefficient collection processes was one challenge you were facing, and then the margin to collect was maybe another one.
Yeah, it was going up, right? Statement costs were going up. So we were seeing, the efficiency and the effectiveness of how we were doing it going down, the cost going up at the same time. As we all know, patients' deductibles and co-insurance have been increasing for the last decade. So we saw, this three-headed monster. AR is going up, our efficiency was going down, and our costs were going up. So it was really, not a good recipe, I would say.
Walk me through the evaluation process when you found MobilePay. What was attractive to you about it?
Yeah. And I'll tell you, James, for us, so one of our kind of innovation, our values in Turno's innovation, we're always looking for early to market products that are going to disrupt the market a little bit or quite a bit in some cases. So we had already evaluated a bunch of systems, and the biggest issue we kept running into is every mobile pay solution required a patient to log into a portal or bump you to another website, was inefficient. And we know as a consumer, I don't know how you are. I don't want to have to, if I have to click on a text and then I got to go log into a portal, then I got to remember another password. It just is, I'm not going to pay my bill. We were looking for something that was simple. We felt like there's so many other things we use in our lives that are single click off mobile, right? Whether or not it's booking appointments at our dentist, our car dealer, whatever, so many things that are easier. We felt like there had to be a better solution. So we invented a bunch of products and just couldn't find anything. The one, they were costly. Two, they weren't overly efficient. There wasn't the ability. They weren't thinking outside the box about how frequently you text and so on. So we were looking for that kind of disruptive technology at the time, and it, came across our desk, which was nice.
Oh, that's great. And, now that you've had MobilePay, now you've been a customer for 4 years, 5 years, we'll say 4 years.
Yeah.
What is the value that it has brought? Like, how do you think about the value that it has brought to your business, collection practices?
Yeah, so several things, some key things, right? One is ease of use for our patients. We're right out of the gate with every client we bring on. And we did this with a large hospitalist group that was seeing very poor self-pay collections. They were one of the, more recent ones we dropped onto in the last couple of years, biggest one, the last couple of years anyway, but we see right out of the gate. One is you're increasing velocity, right? So you got these patients that you're sending a statement, you're waiting. If you look at, I think we were, we're not, without recalling the metric exactly, we were probably at about average patient days from time of service to the day the patient paid was like 60 something days with paper
Yeah.
statements. We've shortened that to somewhere in the low 20s, high teens, depending on the practice. And really, so that was one thing, right? So often you're taking this cycle and shortening up. And a lot of those payments come in the first 7 days, with MobilePay as well. So that was one big thing is we shortened up the process. We're not waiting. Days in AR dropped dramatically after about 3 months once we got the cycle rolling. So that was key. More patients pay. We've seen a spike in everybody we've brought on has had a double digit easily increase in their self-pay collections. Even if they were using another mobile, like we've ripped, the Athena MobilePay, put in the Access One solution because it's more efficient. It's easier to use. So one is, more patients are paying. Everybody, we always see that. Two is we're quick. We speed up the time to payment. That's huge. We reduce statements. That was another big piece of it, right? And that takes a little bit longer through the system, but 6 months in, we saw a reduction across the board in the number of patient statements we were sending out. Again, assuming you're able to work with the system to suppress statements, which we can in almost all the systems now. And then the other piece was chasing small balances. So as a rev cycle firm, and even in a healthcare practice, they're not chasing $15, $20, $25 balances. With MobilePay, you can chase all of those at low cost. And that was a big difference as we were able to collect, especially at our sites that struggled with copays, which still this day, you still see that a little bit on the front end in some practices and these bigger clinics even. So we were able to chase those small balances. So that was another huge piece of it for sure. Depending on who you talk to and you look at the overall cost of processing a statement, it can be $7, $8, $9, right? So to chase a $25 bill or $15 bill makes no sense. Two is then you got to deal with, paper. Is that coming in via paper? Is it getting processed via paper? So it just there's no efficiency. Maybe it makes sense to send one statement, but you're not going to go after that money aggressively. And that's really the biggest thing. It's just cost and effort for very little return. But if you can do it for, a nickel or less than $1 in a lot of cases with MobilePay, then it makes complete sense.
Sometimes it feels like, we'll talk to other rev cycle teams and like, they don't actually care about getting cash in the door faster. Maybe it's because they're just used to 60, 90 days AR for patient balances. But why did that matter for your business?
Yeah. So a couple of things. And I would back that up by saying when we first implement it, we get this little bolus of cash too, because now you take the AR and you compress it. You always get a nice little typically a 2-month bolus of cash, which helps. For us, it's important. So a lot of our agreements are tied to KPIs around days in AR or AR over 90. So we own a lot of that. We share some risk in it and we want to make sure we're getting paid quicker. And I also think a patient is more apt to pay a bill when it's fresh in their mind. I don't know about you, but if I go to the doctor 60 days ago, everything's a blurry, forget about it. But if you're able to get someone, within the first 14 days, get their statement in their hand via mobile, they remember it, it's fresh, they're going to click, they're going to pay, and hopefully had a great experience with the provider. The longer that goes on, the less likely they are to pay. And I've heard the argument that we're consistently always getting our money anyway. You are, but you're really also leaving a lot on the table because patients, once the bill gets to 60, 90 days from date of service, your chance of getting paid continues to drop. And then you start getting to 120 or 180 from date of service and good luck. So there's hitting the patient when it's fresh in their mind, and it ties back to our agreements and really driving KPIs. Most of our contracts are tied to some form of net collection rate, service line agreement. AR over 90 days is typically in there as well, but let's focus on the net collection rate. That's a big one for us. So if we've agreed in our looking at the data when we bring on a client that their NCR, net collection rate, should be 96%, you have to maximize all of your revenue in all areas to be able to hit that. It's not just about collecting insurance. It's not about coding correctly. It's not about your insurance appeals. If you're not effective on the patient side and getting that revenue, getting it quickly, maximizing it, then you're never going to hit your NCR. And for us, that's a risk. We typically, we're out of compliance. The agreement lowers our rate. So without question, when we look at an agreement and you think about these practices, we've got some sites that are 16% or so of their revenue comes from patients. The average is probably 10 or 12, maybe 8 to 10, somewhere in that range. But if you've got if you just for easy math, you've got 10% of your revenue coming from a patient, you don't focus on collecting that, your NCR is not going to hit your target, no matter how good you do on the insurance side. So that's really where we saw the big help to us is being able to attack that revenue, to attack those balances quick, be efficient, still keep costs reasonable, and really keep the NCRs compliant. So that's the single biggest area. Because if you're in my business and you're not chasing, one, it now allows us to effectively chase the small balances, but two, if you're not chasing that patient AR anyway, you're never going to hit your metrics. The practice is not going to maximize their NCR either.
Yeah. And so for someone who's an idiot like myself, what can you just explain net collection rate?
Yeah. Yeah. So net collection rate is ultimately the net of collectible dollars, right? So we've got, when you think about healthcare, we all know that if you charge 100 based on the payer fee schedule, they approve 60. So out of that 60, how much are you collecting? Are you getting 100%? Are you getting 95%? So then when you think NCR, it's a percentage of collectible dollars. And that's really, there's a couple different formulas, but that's the general gist of it. So ideally, if a practice billed $1 million and their payer contracts and allowables said they were supposed to collect 600,000, what percentage of that are you getting? And that goes back to the patient too.
There's almost a proxy for the financial health of the practice or organization.
I think the most important, you're going to measure the health of a practice. We think NCRs. You can talk about AR all you want, but if your AR looks good and your NCR is terrible, then it doesn't make any sense.
Okay.
We feel like NCR drives, really drives that kind of financial health of the practice. It would be a nightmare. So I think because we had two things. One is and the other side of that is we're also typically the call center for our clients or the patient contact center. So if we were strictly paper, one is our call volume would be through the roof and it'll be a nightmare. I mean, just managing it. It's just, we all know, for me, I would have a hard time owning patient AR if I couldn't attack it with a MobilePay solution. Would make no sense to me. If you asked me to be able to keep NCR up and really resolve patient AR without some form of this MobilePay solution, I don't know how there's no way I would guarantee anything for starters. And two, it'd be hard to make money doing it.
We hear this all the time where, for instance, like health systems using Epic will be like, Epic has free texting and so we're just going to go with that. But so how do you think about what sets MobilePay apart compared to other products or other approaches that you've looked at?
Yeah. So for us, and maybe different the way a health system looks at it, but similar for some other pieces. One is integration. We need, the idea that we can roll this out across platforms without a whole lot. My CIO's used the term as the easiest thing he's ever integrated. And he's integrated a lot of stuff over the years. So I think that was one that's still a differentiator to this day. Every time we bring on a new client now, MobilePay is on it, within the first month, by the first patient cycle, part of the implementation plan. Two is just the ease of use and ability. So you have some control over how frequently you send the text, right? Some things work based on specialty. We find different schedules that work better. So we have some flexibility there, and without question, the ease of use. I've seen some of the products you referenced, their MobilePay solution is not simple. It still isn't, right? The idea that you can click, you can pay, and you'll be done in whatever it is, 4 steps or something, not even, I think, with MobilePay. And I've tested it. It's funny. I go to my older parents, my older in-laws, and we've set them up as dummies just because I wanted their experience. And it's funny. So that was the big thing. And then I had a PA friend who worked in an emergency department who saw one of my clients got the bill via MobilePay, and she called and said, "Hey, is this the product you guys use? This is the easiest thing I've ever used." And she's working at an ED that uses a different company and a different solution. So those are the big things. It has to be patient friendly. That was the biggest, and it has to be easy to use. From an integration standpoint, we're probably integrated with over 30 different EMRs and PM. But as far, because even when we go into a practice, they may have various products they're using. From an operational standpoint, we work on about 8 different PMs, but we integrate and pull data from well over 30 different practice management EHRs at this point. We'll bring in MobilePay, analytics, rules-based technology, our automation, coding automation that all work. So they don't have to change PM, don't have to switch up at all on that side. So we just bolt on ultimately. We survey. So we implemented a front end survey on the phone. We also send out surveys post to some of these patients. And we're running, to give you an idea, I think our last, and we do this on a monthly basis. We were running at a 97% patient sat rate, which means their digital experience was good. It means if they interacted with a person, it was good. So obviously that's feeding into that. So that tells you that, we're getting nothing but positive feedback on it.